inflammation. I may decrease blood flow, I may increase blood flow, it depends on who you read. Some people suggest that it's cold, locally cold, which may increase local circulation to try to warm it back up to the temperature that everything else is.
Compensating for it.
Yeah, trying to compensate for it, but it is probably vasoconstricting a little bit, but we want to try to move things. What else? Reduce pain. Ice, or cold, unlike heat, actually has some analgesic qualities, right? So we may actually decrease the pain receptor impulses getting to our brain by numbing it up. Anything else? All right, so now I need to screen my patient for indications or contraindications for precautions. There's not a lot. Have you ever had any problems with cold? Have you ever had frostbite or found yourself to be real sensitive
urticaria
of cold? Do you have it?
No.
Okay. I'm not going to ask the person. I don't typically say, do you have cryoglobulinuria or urticaria? I say, have you ever had any issues with cold, Raynaud's or anything else? Raynaud's, if you have Raynaud's, you know you have it. If you have one of those other fancy names, you know you have it. But I just want to know, oh yeah, whenever they put ice on me, it hurts too bad, or I turn white, or so I don't go into all the fancy names. I just say, look, if you ever had any problems have you ever used ice before? Yes or no? If they say yes, did you have any problems? No, well, how come? Have you never iced anything? Well, it's just not what we've done or whatever. I'm going to talk to them about why they might want to use ice. So I'm going to explore that. I'm going to ask about Raynaud's, hypersensitivity. If there's a surgery site there, I would ask what kind of surgery they had. Hopefully you know that, and your PT didn't suggest that you do this over a fresh nerve surgery. Although, I could see someone with like carpal tunnel and they just had a release and someone's not thinking and says, hey, why don't you ice that down to prevent edema and stuff. And then I'd probably want to make some inquiries into whether or not that's really the best thing for me. It might require a call to the physician's office. So I'm going to assess the treatment area. What do I want to look for? On the treatment area where I'm going to stick this.
Open wound or something?
I'd like to know if there's an open wound. I'd like to know what color the skin is before I start. I'm not going to have a very good picture of how it reacted to my cold if I don't know what it looked like before I started. We ice total knee replacements all the time, so having a suture line or something like that isn't going to stop us from icing, but I still want to know what that looks like. Swelling, edema, sometimes it's appropriate for swelling and edema. I just want to look at it first and see what I'm dealing with, get my appearance. If I touch it and it's already freezing cold, that limb, maybe ice isn't my best choice today. Maybe I need to make some phone calls and have some conversations because that freezing cold limb would indicate to me there's maybe some circulation issues. So, contraindications would probably be definitely Raynaud's or any of our fancy issues with cold.
Was the ice that could cause like wheals or hives on some?
They can,
Yeah,
you can get hives and
If you
stuff.
see that on them starting to form, what would you?
I'd probably stop
You would stop.
and ask them how it feels and then do some exploring.
Okay.
Okay?
Do you want to ask them at all about numbness?
Yeah, sensation would be good to know if they have this
I mean, 'cause
sensation.
it can be
If they're
feel
completely,
normal, but if they can't feel
right,
it,
if they don't
then-
have any sensation there, I'm going to have to either not do it or watch it closer. All right, here's a key one that people seem to miss a lot when we do the cryo and the hot pack is position and drape appropriately, have patient remove clothing from the area. So position and drape appropriately means whether I'm doing hot or cold, I need to make this person comfortable. If they're going to be chilling or heating for 20 to 30 minutes, I need them in a position that's going to be comfortable for them. If I'm going to be icing this person, especially, I need to make sure I get some extra blankets and stuff on them. most of my patients are not going to tolerate. They're already cold probably. Just hospital, rehab facility, no matter where you are, people tend to be cold. So you slap ice on them for 20 or 30 minutes, they're going to be really cold and shivery, and that sometimes is one of the reasons they don't like it, is because they get cold everywhere. So if we can keep everywhere else warm, I want to be able to see the location. So when it says expose the area, you know, if I'm doing a hot pack or a cold pack, I might, and all you have on is a thin t-shirt, I might look at it, check everything, I might put it back down and actually go over, put the heat over it. I don't have to leave it exposed, but I do want to see it. A lot of times with ice though, it's the closer I get to the surface, the better. So, and plus ice sometimes will get the person a little bit wet, so I like to try to keep their clothes dry and not stick my wet towels and stuff over the top of.
So unlike heat with the cold, you're putting the pack directly on their skin, there's not any kind of towel in between?
I do, I always put something in between.
Okay.
I will either, at one facility I work at, we use pillowcases, and we use crushed ice and we fill it up. But I want something really thin, I just don't want to put my pack right on. Pam's favorite trick to do is to take a wash rag or a towel and get it wet with warm water. And so now I've got warm water on you. Since you're the one that has an exposed knee here. So that's not that cold, right?
No?
And then I can come over here and you gradually get cold instead of immediately get cold. And I would secure that with maybe a strap or something cleaned up after you. Just so I think this pan. I might use one of these little stretchies with Velcro on it to hold it on there. I'll use towels and tuck them in, or I'd want to get her comfy and drape her with a towel or a blanket or something over her shoulders to keep her warm. But this way, it kind of gets cold slower than shocking them. So that's one of Pam's little tricks that she likes to do, is soak that first. Honestly, a lot of places it's just going to be towel. At home, what I do is I get a couple of paper towels. I put crushed ice in a Ziploc bag, a freezer bag, and then a couple of thick paper towels and soak them with warm water and stick it on my child, and then put the ice on them because they tolerate ice that way a lot better than they do when I just tell them to get an ice cube out and rub it on it. Okay, so there's 2 ice packs out and they're actually cold. There's 2 more in the freezer, so when we get to that,